Hello friends, today we are discussing a case. I had this case of a 57-year-old lady who was a principal in a school, and she came to me for joint pains. In the joint pains per se, I could not get too many characteristic symptoms. It was a typical morning stiffness that she had, and the joints that were swollen were her hand joints and the knee joint, etc. So I asked her how did it start, and she says that her hypertension, her blood pressure and her joint pains all started 12 years ago after a specific disease, which was after her heart attack. And on asking for the heart attack symptoms, she said it started with a burning pain in the sternum. She had acidity for 2-3 days. Then she lost sleep because of a workshop that she had to attend. But what was interesting was the heart attack per se, she started feeling pain, sharp pain in the heart region, which radiated to the left arm. And along with that, she had a feeling that her eyes are being pulled inward as if they are sinking deep into the sockets. And these symptoms subsided in a while, and then she went to the hospital. In the hospital, they checked her up, they did her ECG, but they said everything is fine, your BP is fine, your ECG is fine, everything is fine, you can go home. But she was adamant, and she said that I know there is something wrong with my heart, so please get me admitted. And as they admitted her, they said, oh, it's okay, if you have so much of a doubt, we'll also do a 2D echo for you. And on the 2D echo table, she says, as I turned to the left side, as I was lying down and turned to the left side, I got a heart attack actually. I went unconscious, and before the unconsciousness, I was conscious for around 2 minutes, in which I had a very sharp pain, and the pain was in the heart region as if it is being pressed and hit on it. And this after this pain, I went unconscious. I was in the ICU for a day or two, and after that they started me on the treatment, after which my diabetes and hypertension also got diagnosed. So I said, okay, what were the diseases before this? And she says she had no disease before this. She didn't take a single pill before this. So I said, okay, what is the stress before this that you had? And initially she denies any stress, but on asking 2 or 3 times, she tells me that around 12 days before this heart attack, she had an incident in life where her brother and his wife were fighting very loudly, and she stays just 1 floor apart. She was called by somebody that try and solve this. Whereas as she entered the room, she says she was quite aware what is going on, and as she entered the room, the very loud noise of these two fighting, that started giving her a sort of confusion where she could not understand what is going on. And this loud noise and fighting gave her this confusion, and she started feeling that it is beyond her capacity. It is, she got overwhelmed with it, and she was taken out by the person who got her in, and she said she was totally weak after that. And she says as she calmed down outside, she realized that when she went inside, the two of them started blaming her, and because of that she got very angry. And with the anger, this weakness set in, and with the anger, she reacted in a way where after this point in time, for 2 years, she was not talking to them. So in this case, if we understand that the current symptoms are all common symptoms of the disease, the first symptom that she got, the main disease that she got, the heart attack, if we take those symptoms, again radiating towards the left arm is common, but this pressing pain, palpitation, etc., the heart symptoms and their modality of lying on left side aggravates, this should be considered for prescription. In addition, we should also consider this the stressful incidents where she got very angry. Along with anger, what came was a weakness, a feeling of being overwhelmed, and the reaction to this anger, that she had a hatred for this person for a long time after that, which is for 2 years she just didn't talk to them. This is a very typical reaction of the remedy natrum carb. Aversion to certain persons and anger with weakness. This is what is natrum carb, along with the heart symptoms aggravated lying on left side. So this patient got natrum carb. In around 6 to 8 months time, her joint pains were very much reduced. Her sugar was quite in control, after which she retired from school, and after retirement her life situation changed, her other stresses changed, after which the sugar got a little out of control and we had to change her remedy to causticum. The point is, while solving the case in the first go, the way we solve the case, the way we analyze and evaluate the symptoms is important to understand, and this we are going to teach in Prana from the 23rd of September in a live case based workshop which we call Practical Training in Classical Homeopathy. Here you will be here for 2 weeks, and in these 12 days of working days we will be having 4 days of lectures on how to take the case, how to analyze and evaluate the symptoms, what are the rubrics to be taken, and how to reach the remedy. Also a little bit on follow-up management. And 8 days will be live cases where you will learn from such cases that you heard right now. So I would like to welcome you to this PTCH, Practical Training in Classical Homeopathy, which starts from 23rd of September. Thank you.